Hello and welcome on behalf of the UCD College of Health and Agricultural Sciences. We are unique on the island in Ireland of having 5 schools organised around the One Health principle. Both in our schools and in our institute workings, we reflect that philosophy.
We in UCD are very strongly committed to the One Health agenda. It plays to our strengths as a university, our great diversity of disciplines, our excellence in research and in teaching. It also plays to our values aligned with the UN Sustainable Development Goals, and so we are delighted to be supporting this in every way we possibly can. Our relationship with the WHO is very, very important to us, and we are delighted to be having very serious discussions with the WHO about how we can jointly progress the One Health agenda.
I am Dr Hans Kluge, the WHO Regional Director for Europe and Central Asia, and I would like to congratulate the UCD for today's opening of the One Health Center. UCD is a very close collaborator of the WHO and a frontrunner. They're part of the Technical Advisory Group on One Health, and one of the fields that we are going to work together is on core competencies for the workforce, how to lead and operationalize One Health into practice.
One Health is an approach that will help to address some of the challenges that we face in the world, from climate change to energy distribution, to conflict, to migration, that all have a bearing on our well-being and our health, and impact not only the health of humans, but the health of animals and plants, and the health of the very planet itself.
But a One Health approach will mean engaging with new disciplines, collaborating across sectors, building capacity, influencing policy, and advocating for health in all its dimensions. And doing so is necessary to enable us to create a future that is truly sustainable, just, and healthy for all. We are one world, and the purpose of One Health is to help us realise that and take actions that recognise this. And through this important step that we're taking here in UCD in establishing the Centre for One Health, I hope that we can build a national collaboration with other universities who are here in the room and others, government agencies, industry, and all other stakeholders, and thereby make a contribution to addressing the growing challenges that face us in the modern world.
And so I suppose when we think about something like a Centre for One Health or One Health in general, really what it is it isn't a thing, One Health. It isn't something that we can tangibly hold. What it is really is a mindset. It's a philosophical change that we're trying to encourage. It's a way that we approach challenges. It isn't the way that we think historically of individuals or individual institutes or individual expertises working independently. It's a promotion of the idea that in order to face and tackle challenges, we have to work together. We have to break down those barriers, both on a university level, on a societal level, but also on a government level, on an industrial level. And if we don't do that, then we're going to miss something. We're going to have unintended consequences in whatever action we take if we don't consider all disciplines and all angles of each of these challenges.
So there are an endless number of priorities that the Centre for One Health could focus on. Some of the more pressing ones would be antimicrobial resistance, zoonotic diseases, but also things that people often don't think about, like mental health.
And I think certainly on an all-island basis, when we're looking across a single epidemiological unit at infectious diseases and AMR, we're being affected by the same climate change, north and south. So let's look at this collaboratively in that sort of One Health spirit of collaboration and communication.
So I think one of the areas that we can really have a tangible effect on is education at all different levels. So from the public through primary schools, secondary schools, and also at university level. So at both undergraduate and postgraduate education. So, you know, we have unique resources here within UCD to foster collaborative links between the different schools.
We are delighted to be working with the WHO to devise what One Health should look like into the future. What are the competencies that we need? What are the deliverables that we will be pursuing?
Congratulations to the UCD, and we're very much looking forward to a fruitful collaboration leading to the first WHO collaborating centre on One Health in the whole of the European region. Thank you.